Greetings. So, if you have listened to the arterial blood gas videos so far, um, you'd be able to manage majority of questions that you're going to be seeing on the boards and on tests and assessments. Um, in this video, we will talk about interpreting acid bases. And essentially, uh, you would be given a pH, PaCO2, PaO2, and bicarbonate. And you're going to be asked what kind of acid base disorders do we have. Now, there's a textbook, correct, detailed way of doing this. On real patients, that's what we need to do. So let me just go over the steps with you. First step is calculate the anion gap. If there's an anion gap, you have high anion gap metabolic acidosis. Then we calculate the delta gap and see if we have non-anion gap metabolic disorder in there. And that has the potential to give you two disorders right off the bat without even looking at any of the pH, PaCO2, PaO2, and bicarbonate. It's just looking at our salt and bun. Remember that? Salt and bun. So we had sodium chloride on bun, right? And then we had what? Glucose, sugar, right? So you have creatinine, bicarb or CO2, and then potassium, right? So that's step one. Step two, we look at pH and PaCO2 to determine if the primary diagnosis is respiratory or metabolic. The last step is to apply Winter's formula to tease out whether the compensation is appropriate. If not, you're actually having additional acid-base disorders in there. Now, Prashant, we didn't cover delta gap and we didn't cover Winter's formula. That is correct. We did not cover Winter's formula, which compensate for 6 disorders that we talked about. What were the 6 disorders? Acute and chronic respiratory acidosis, acute and chronic respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. So that's 1, 2, 3, 4, 5, 6. We didn't do any of that stuff. That is correct because this textbook way of doing acid-base disorders and ABG interpretation is very accurate, provides you lots of great information, but is extremely complex, extremely memory intensive. So if I get a lot of requests, I am going to, in the future, maybe create a video of how to do it. And with the video, I'm going to create a worksheet that can be used in practice to actually do ABGs. However, because it's very complex and very memory intensive, I do not believe that we can have a full detailed ABG analysis on a board question. I do not believe that this is going to come to pass. As such, I also believe that if your board exams is not going to ask you full detailed ABG analysis, I don't feel that that is a question that is reasonable to ask on your prep exams. In other words, your finals, your midterm exams. I don't think that's reasonable. It is way complex. Okay? It is way complex. If you are doing it, my question is, has your instructor taught you how to do delta gap? Has your instructor taught you how to do Winter's formula, how to apply Winter's formula for 6 different types of compensations? They're all different, and they are extremely complex. And if they haven't, and they're expecting you to do it, there's a mismatch there. What I have seen is questions that tease out the basic ability to interpret arterial blood gases. So I have an abbreviated shortcut approach to basic ABG analysis. Right off the bat, it's not perfect. Anything that's a shortcut will take you to a place faster. It's not the textbook way. And usually I've tried to veer away from things that are shortcut. When we do electrolytes, I'm not teaching you or sharing with you how to memorize stuff. I'm giving you principles of how to do it, an approach on how to do it. So this is a very difficult thing for me to do, is to give you a shortcut, inaccurate, non-perfect approach to ABG analysis. But what this will give you is a very, very basic ability to interpret ABGs. And that may help you with some questions you may see on your exams in school. I still don't believe that on your NCLEX or CGFNS exam or board exams, you're going to have a full detailed ABG analysis question. That is way outside the scope of practice of a nurse that has entered practice. It's way too complex. Okay. But this will give you an ability to do some basic ABG analysis. It's not perfect, but you know what? You're not going into the test dreading as to how you're going to slay those questions. This approach will help you slay those basic ABG questions that are going to be on your school exams. Okay? Here's the steps. So you have to remember the normals. pH, PaCO2, PaO2, bicarb. You got to know them cold. How do I know them? Practice. After this, you have to do at least 50 arterial blood gases. Go online on Google on one of the search engines and do sample questions. And keep doing them, keep applying these steps. And I guarantee you after 20, you're going to learn this. After 30, you're going to be amazing. And by the time you're at 40th and 50th and you've revised every couple of weeks, you're going to slay those questions. Those are going to be your gimme questions. So let's go through the steps. Step 1, what's the pH? Acidemia or alkalemia, compensated or uncompensated? This is the decision tree. 7.35 to 7.45. Anything less than 7.4 is acid. Anything greater than 7.4 is alkalemia. Compensated. Normal is 7.35 to 7.45. Anytime a pH is between 7.35 to 7.45, it's compensated. Anything outside is uncompensated. Step 2. Respiratory side is bringing what? Acidosis or alkalosis. If PaCO2 is less than 35, it's bringing alkalosis. If PaCO2 is greater than 45, it's bringing more carbonic acid or it's bringing acidosis. What is the metabolic side bringing? What's the bicarbonate? Acidosis or alkalosis? If you have more bicarb, it's bringing in alkalosis more than 26. If the bicarb is less than 22, it's bringing in acidosis. Got it? Step 4, match step 1 with step 2 and step 1 with step 3. This will tell you who's the culprit and who's compensating. Step 5, look at PaO2. If PaO2 is less than 80, you've got hypoxemia. Can you remember these steps? And the answer is not no. The answer is yes, you have to remember these steps. So again, pH. There's two things you're going to get from pH. If it's between 7.35 and 7.45, it's compensated. Otherwise, it's uncompensated. If it's less than 7.4, it's acidemia. If it's greater than 7.4, it's alkalemia. What's the respiratory side bringing? PaCO2 is higher than 45, acidosis, less than 35, alkalosis. What's the metabolic side bringing? Bicarbs less than 22 acidosis, greater than 26 alkalosis. Match step 1 with step 2 and step 1 with step 3. And that's what we do in step 4 to find out who's the culprit and who's compensating. And last step is look at PaO2 to see if you have hypoxemia. If PaO2 is less than 80, you have hypoxemia. Got it? Remember these steps. Now, let's do some sample questions. And before you know it, you'll be experts. This is your ABG, 7.32, 49, 70, 25. pH is 7.32. PaCO2 is 49. PaO2 70. Bicarb is 25. So what's the pH? Let's apply the steps. 7.32. Is it less than 7.40? Yeah. So is it acidemia or alkalemia? Acidemia. Is it between 7.35 and 7.45? 7.32 is right here. So it is acidemia and it's uncompensated. So it's uncompensated acidemia. PaCO2 is 49. Respiratory side is bringing what? 49 is right here. Acidosis. Metabolic side is bringing what? Bicarb is 25. It's not bringing alkalosis and it's not bringing acidosis, so it's bringing nothing. Now, let's match step 1 with step 2. We had uncompensated acidemia. And step 2 gave us respiratory acidosis. Uncompensated acidemia, metabolic side is bringing in nothing. Acidosis is matching with acidemia. So this is what? Uncompensated respiratory acidosis. This is culprit. This is cause. Okay? PaO2 is less than 80. 70. It's less than 80. So there is hypoxemia. So it's uncompensated respiratory acidosis with hypoxemia. That is the respiratory. So that is the acid-base disorder. That's the interpretation. Now, remember the previous video, respiratory acidosis. Kidneys are not compensating. They haven't compensated all the way through. So this is acute in nature. Okay? If I have respiratory acidosis, what will I expect? How can I manage this on a ventilator in an intubated patient? Right? Too much acid, too little pH. I compensate by decreasing acid. Okay? Sorry. You have increased acid and lower pH. So I compensate by decreasing acid and upping the pH. And I do that by decreasing the CO2. And I decrease the CO2 by increasing the respiratory rate and the tidal volume or the tidal volume. How do I manage the O2, PaO2? PEEP or FiO2? Good? Easy peasy. Let's look at second case, 7.38. 47 is the PaCO2, 85 is the PaO2, and 27 is the bicarb. Do not skip steps. Do not take shortcuts to this shortcut, because you'd get in trouble very, very quickly. Okay? 7.38, where is that? It's right here. Is this compensated? Yes. Is it acid? Yes. This is what? Compensated acidemia. PaCO2 of 47. 47's right here. Acidosis. Okay. Bicarb of 27. Bicarb of 27. So this is bringing what? Alkalosis. Now I got to match. So I got to match uncompensated acidosis with compensated acidemia. Compensated acidemia with step 2, which gives me respiratory acidosis. Compensated acidemia with step 3, which is metabolic alkalosis. Which one is matching? Acidemia is matching with acidosis. So this is what? Compensated respiratory acidosis. Yes, that's the cause. However, you also have a metabolic alkalosis. So compensated respiratory acidosis with metabolic alkalosis. The metabolic side is trying to compensate. And it is, that's why it's chronic respiratory acidosis. Hypoxemia, again, remember it's greater than 80? There's no hypoxemia, so I'm good. Done. Easy. Let's look at a third one. Before you know it, you'd be experts. In fact, I'm going to let you lead the way. 7.47 is the pH, 31 is the PaCO2, PaO2 is 50, bicarb is 22, 7.47. What do you have? Pause the video. Now, did you get uncompensated alkalemia? If you did, you got it. PaCO2 of 31. What's normal? 35 to 36, 35 to 45. 31's right here. This is alkalosis. Okay. Bicarb is 22. It's right here. It's neither acidosis nor alkalosis. It's nothing. So you had uncompensated alkalemia, which got, and then we matching this with step 2, which is respiratory alkalosis, and uncompensated alkalemia, step 1 with step 3, which is metabolic side, which is bringing in nothing. So which ones are matching? These two are matching. So it's uncompensated respiratory alkalosis. And there is hypoxemia. Remember, it's 50. So it's uncompensated respiratory alkalosis with hypoxemia. So remember, it's acute respiratory alkalosis because the kidneys have not compensated. Okay? Easy? Okay. Let's do another one. Keep doing a bunch of them and you'll be experts in no time. This is pH. 7.43, PaCO2 32, PaO2 95, bicarb of 21. pH is 7.43, it's right here. Is it alkalosis, alkalemia, or acidemia? It's alkalemia. Is it compensated or uncompensated? Compensated. So it's compensated alkalemia. What's the respiratory side bringing with the PaCO2 of 32? 32 is right here. It's alkalosis. What's the metabolic side bringing? Bicarb is 21. 21 is right here. It's bringing in acidosis. Right? Now let's match step 1 with step 2. Compensated alkalemia in step 1 and then respiratory side alkalosis in step 2. They are matching. So for sure you have compensated respiratory alkalosis. And then compensated alkalemia is not matching with metabolic side acidosis. So you have what? Compensated respiratory alkalemia with metabolic acidosis, right? And then you have hypoxemia. So you have compensated respiratory alkalosis with metabolic acidosis and hypoxemia. Well, actually, If your PaO2 is 95, you don't have hypoxemia. So no hypoxemia. So it's just compensated respiratory alkalosis with metabolic acidosis. Okay, and again, it's chronic. Why? Kidneys have compensated. Okay, let's take a look at the next one. Guys should be getting good at this. Okay, whenever you see this on a test, just create little these steps and apply, and you will get to the right answer. pH 7.34. Okay, pH is 7.34. PaCO2 is 36. PaO2 is 78. Bicarb is 21. pH is 7.34. Uncompensated uncompensated acidemia. Respiratory side with 36. What's that going to bring? Nothing. Okay, bicarb is 21. What is that bringing? Acidosis. Now, uncompensated acidemia is step 1. That's matched with step 2, which is respiratory side is bringing nothing. Uncompensated acidemia, step 1, is matched with metabolic acidosis. That's what step 3 brought us. So again, you have a match. Acidosis and acidemia match. So it's uncompensated metabolic acidosis. And that's the culprit. Again, you have PaO2 less than 80. So you have hypoxemia. So you have uncompensated metabolic acidosis with hypoxemia. Now, let's do another one. You have pH of 7.44, PaCO2 of 46, PaO2 of 120, and bicarb of 28. 7.44 is right here. What is this? Compensated alkalemia. Respiratory is 46. It's bringing what? Acidosis. Metabolic side, bicarb is 28. It's bringing alkalosis. So you have compensated alkalemia from step 1. Respiratory side bringing acidosis. So both don't match. Compensated alkalemia is matched with step 3, which is metabolic side bringing in alkalosis. So metabolic alkalosis matches with compensated alkalemia. So it is compensated metabolic alkalosis with respiratory acidosis. Is there hypoxemia? No. It's greater than 80. 120 would be hyperoxemia. But again, we don't have to actually capture that, but it's compensated metabolic alkalosis with respiratory acidosis. Okay? So let's do a quick recap. Okay? Let's do a quick recap on what we did. So we talked about arterial blood gas interpretations. We looked at the textbook way, and we know that we shouldn't be expecting a full detailed ABG analysis as a question on our formative exams and on the board exam. What we may be asked in our school exams, formative exams, could be a basic ability to interpret ABGs. And the basic, non-perfect, shortcut approach to ABG, which is simple, I've given that, which is look at pH and see whether it's compensated or uncompensated pH, and whether the pH is acidemic or alkalemic. See what the respiratory side is bringing. See what the metabolic side is bringing, and then see which one is matching with the pH. And then once that's done, you actually get your statement, then you see whether there's hypoxemia or not. And then we looked at 6 examples. Okay, and what you can now do is do a bunch of arterial blood gases, and before you know it, it's going to become muscle memory, and it's going to be points that you'd be able to get correct, questions you'd be able to slay and do really well on.